Polly, and my background is nursing, and I'm the proprietor for Eileen Moffat Care. And Eileen Moffat Care is a care home. What is a care home? A care home is a home where we care for people. And the care home is side to side with home care. When care becomes too complicated at home, it becomes too hard at home, and it can't be helped at home, you might have someone who's beyond what the family can cope in. The person might have been released from the hospital, discharged from the hospital, and after they've been discharged from the hospital, then they get home and you feel, oh gosh, this is too much as well, we can't cope. So that's where the care home comes in. The care home steps in at home to be a home for the patient or for the resident in a different environment. And in the care home, we have nurses, we have caregivers, the physios come in. We've got all sorts of disciplinaries coming into the home rather than going into the patient's house. Going into the patient house sometimes could be tiring for the family. Maybe they've been going through this period for a long time, and now they feel like we need a break, and not a break from your loved one, because even in the care home, you can come and see your loved one. So that's what the care home is about. And it is 24 hours care, and we look after the person for 24 hours. You come in and see your patient, your mother or your father or your sister, your brother. They are being looked after like they were in the hospital, but in a home setting. What we tell people is because if you've got someone who is unwell and you are not able to do it, and then you don't get specialist care, or you don't get the people who actually can do that, then it means that you're being negligent in one way or the other. I'm not saying this in a bad way, but you should look at the needs of this person. At times when you have someone who is unwell and maybe they have an wound and you haven't involved a nurse, and then you try and treat this wound yourself, and then it gets infected, then the consequences of the infection on the wound, it's bad, because sometimes you need to take them back to the hospital. But if you could get a specialist person who can dress this wound, look after this wound until it heals, then the end result is good, and it is less expensive. So it's always good to involve the right people. And why I said it's the same concept with bringing your parents to a care home is because the same myth about laziness and people being negligent is what surrounds a care home. What I mean is a care home is looking after people in a controlled facility. That would mean that if you bring your mom or your dad there, people are going to say you hate your mommy, you hate your daddy, and you've taken them out to a strange place because you are unable to look after them, you are negligent. But that's not the case. Actually, the opposite is the case. When you are negligent and your parents are at home, they are with the house girl maybe. I'm not saying all the house girls are not able to do that, but you are someone who is not able to provide this care, then you're actually being negligent. If they are in an area where they are being provided for, and they are, all the help is being given, and that doesn't mean that you never see your mother again, that you've taken her to an island where you never see them again. It's the same concept. The way you provide the care and the decisions you make for your elderly people, your elderly parents, or your sick people is very important, because the decisions you make determine the end of that person, the end result. I don't mean the death, or is because how that person is going to heal, or that's how that person is going to progress. That's what determines the care you provide. Thank you very much for watching this video and listening to us, giving us time. And you can book our services through ponea.com. There is a whole lot of information there about us.